Good afternoon, everyone. My name is Cameron Friesen. I'm the Minister for Health, Seniors and Active Living for the province of Manitoba. It is time for our Thursday regular update to Manitobans. Welcome all who have joined us. I'm here with Dr. Brent Roussin, Manitoba's Chief Provincial Public Health Officer, and let's get started with Dr. Roussin's report.
Thank you, Minister. Current 5-day COVID-19 test positivity rate is 1.7%. We have 11 new cases of the virus reported as of 9:30 a.m. today, bringing a total number of cases in Manitoba to 1,500. One case in Prairie Mountain Health, 2 cases in Southern Health, and 8 cases in the Winnipeg Health region. We have 293 active cases and 1,191 individuals have recovered. 10 people currently in hospital, 2 of which are in intensive care, and the number of deaths due to COVID-19 remains at 16. Lab testing yesterday was 1,403, bringing our total number of lab tests completed to 160,109. As testing sites locations may change in response to change in testing volumes, Manitobans are reminded to refer to the list of current testing sites on our website, manitoba.ca/COVID-19. Starting tomorrow, Friday, September 18th, Prairie Mountain Health region will be lowered to the COVID-19 caution level, yellow, and that's according to our pandemic response system. Manitobans in Prairie Mountain Health region really stepped up in August and until now to really flatten that curve again and bring down those numbers. We know that when we first initiated the pandemic response system, elevated to orange, there were 240 active cases in the region, and today that number is down to 38. We know that looking back at the test positivity rate, it peaked at 5.6% in Prairie Mountain Health, and today that is at 0.4%. So what this shows is that something we all know is that we know how to deal with this virus. We know what to do to limit our risks, but we know that we have to stick to those fundamentals. Those avoiding group sizes, avoiding crowded places, avoiding crowded indoor places, physical distancing, hand washing. We know the importance of masks indoor public places, especially when you can't physically distance, and we can predict that when we don't follow that advice, we can see numbers going up, and we can predict that once we get back on track, we see those numbers going down. So at this point, we're able to once again refer back to yellow in the Prairie Mountain Health region because of that, the great effort put in by the people of Prairie Mountain Health. So starting tomorrow, mask use would no longer be mandated in Prairie Mountain Health region. But we know, and we've been messaging, the value of wearing masks in indoor public places. And I would encourage people in Prairie Mountain Health and everywhere in all places in Manitoba to wear masks in indoor public places, especially if you can't assure physical distancing. So we still strongly recommend that mask use. We know that wearing a non-medical mask does not necessarily protect the person wearing it, but helps the people around them. So the more people that are wearing masks, the more people that will benefit. And we have guidance for how to use those masks properly. Obviously, they're only going to provide protection if they're used properly and consistently. In Prairie Mountain Health, gatherings were at 10 indoor and outdoor at the restricted level of orange. They'll now increase back to what we have in all of Manitoba, 50 persons indoor and 100 outdoor. And similar to other areas in the province, the physical distancing measures will remain in place in many of those sectors, and we'll expect people to continue to follow that. And we'll, of course, continue to follow the many metrics that we do at the province and the regional level to update our pandemic response system as required. We know that there are a number of places within public health or within Prairie Mountain Health that are still restricted based on outbreaks at personal care homes. Those are unchanged at this point, but will again be reviewed over time. As far as John Pritchard school update, that remains at 7 cases. None of today's cases are linked to that cluster. A bit of an update on that. We mentioned yesterday that there was a single case that we were unable to link to the one cluster, the main cluster. After further investigation, we are able to clearly link that case to that cluster, which is it's always nice to be able to link cases together. It leaves that less uncertainty as further spread to be expected. So more to come on that as our investigation continues. We talked about the fundamentals already, and I think that Prairie Mountain Health is a great example of getting back to the fundamentals. We saw what had occurred when we possibly lost track of those fundamentals. When we get back on track, we saw relatively quick drop in number of cases in Prairie Mountain Health. So I encourage all Manitobans to stay on top of that, to use that as a great example that we can move forward with this and live with this virus. Again, we talk about the importance of stigma, especially as we start seeing cases in schools, is that no one is to be blamed for having COVID-19. No one's asking to have COVID-19. They have obviously acquired it from someone. So stigmatizing someone who has COVID-19 is unacceptable at that individual level, but it also impairs our ability to manage this pandemic. It's going to decrease the likelihood of people coming forward and getting tested. So please keep that in mind, be kind, and we'll definitely get through this together. So visit our website for credible information, manitoba.ca/COVID-19. And thanks. We open up to some questions.
Dr. Roussin, how will turning people away from testing sites in Winnipeg because of capacity issues impact the public health response to the pandemic down the road?
Yeah, so testing is certainly a big component of our response, and so we're working on that capacity. We don't want to be turning people away. We don't want to be having extended wait times. So, but we know there's demand on those testing facilities does fluctuate and fluctuates quite quickly. So we are working on increasing that capacity.
Can we expect to see more cases of COVID-19 in the community because contacts aren't being identified and isolated as early as possible?
Well, we can expect to see more cases because we're in a pandemic, so we definitely will see more cases. Rapid case identification, isolation, contact investigation, all important aspects of this, and certainly testing is important on there. So we definitely will be working on that.
Is there any sense of urgency to ramp up the capacity?
We've been working at an urgent level since the very beginning of this pandemic, and we'll continue to.
So just for 2 days, there's been some people turned away at Winnipeg sites. Yesterday you said public health was working on opening more sites, but weren't able to figure out an exact time when that might happen. Mm-hmm. At this point, do we know a week, 2 weeks, a month?
Yeah, I can't really say a specific timeline. There's location, there's staffing, there's all these things that go into place. And like I said, when we at the beginning of the pandemic, when we ramped up very quickly, we had people in the healthcare system that their normal work was put on hold. We don't have that issue right now. So, but it is something that we're definitely paying attention to.
Are you looking to outsource the task then? Because if you don't have healthcare workers available.
Well, I mean, nothing is really off the table in our response, and so we're going to look at whatever we need to do for to increase capacity.
Have you learned anything more about the outbreak at John Pritchard? How it started, how it spread? Was it a case of people too close, intermingling outside the classroom?
We don't have anything more on that. We do the update that we had is that the connection of that outlying case, which does bring down the amount of people that we think might be close contacts with it. But as far as the what is actually index case or the degree of spread, we're still doing the investigation.
And because of the number of cohorts involved. It sounds like it was one person moving between cohorts. That was
the only the outlier Only the outlier may have had some limited contact with those other cohorts. Because we weren't able to link that outlier to the cohort, then it makes us raise the question, did they acquire it from those other cohorts? And so now with more information, we're looking at that single cohort is likely the key cohort.
Is it confirmed only one cohort then, right now?
Well, our investigation now has linked all the cases to one cohort.
And that's one classroom, correct?
Yes.
At this point, do you have any idea of why the demand for testing has increased here in Winnipeg? Has there been any, I suppose, outreach to figure out why more people are lining up for tests?
Well, I think it's, I mean, I don't know for sure, but what we would think about is that we're just seeing increasing cases in Winnipeg, which is drawing more attention and people getting tested, so that's very likely it. We are coming into respiratory virus season, but I haven't yet seen, a significant increase in other respiratory viruses as of yet.
What's the test positivity rate for Winnipeg right now?
Well, didn't really, we can't really report per region on a regular basis. We have 1.7% overall. But for Paramount Health, we were able to do it sort of retrospectively as we did it. There's some limitations when we calculate that.
And the community transmission rate for Winnipeg, please don't say 20%.
Well, I can give you absolute numbers. It's 19 cases in the last 7 days.
Out of,
Well, they have 209 active cases right now, which is the last 10 days.
okay, that's about 20%. Can you tell us more about the new testing strategy, just similar to Eric's question that you talked about yesterday?
New testing strategy?
Well, okay, you said you were gonna come out with more places. Sorry, maybe we misinterpreted. There's no way that you're gonna change the way that you're gonna be testing people?
Well, no, I don't think, I don't think there's necessarily a change other than increasing capacity. I do know that we're looking at, evaluating the testing, our whole testing program.
I can speak to that as well.
Please.
We are very interested in this, as Dr. Roussin has clearly said. Everything from the top to the bottom, from the front to the back of that process matters greatly. Our capacity for screening, our ability to receive those at laboratory and test them, our ability to return the results positive and negative to people in a timely manner, all of these things are critical linkages. The challenge right now, and not just for Manitoba, but all jurisdictions, is exactly as Dr. Roussin said. The workforce that we deployed in the first iteration was the workforce that had been moved out of doing regular things. So now we have a multi-pronged approach where we are trying to get our surgeries and procedures back on track. We have an aggressive strategy to be doing those in hospital settings, but then we have to think hard about how we also now create the capacity for these things. I can tell you that we're conducting a whole-scale assessment of our capacity now from every vantage point: human resource planning, operational, logistics, workflow issues. We want to know what we're doing well. We want to know what we could improve on, and we're doing that work now because we'll need it for later this fall.
And what we have you here today,
Sorry, at what point do you think that assessment will be completed?
As soon as possible. I'm hoping to have this work done from the time it starts to have recommendations for improvements within a matter of weeks.
Minister Friesen, what additional resources is your government offering to get space and staff lined up for more testing sites?
Well, actually, we're doing a lot of work. System planners are working collaboratively with all kinds of groups. I understand there's a good conversation going here between public health provincially and the city of Winnipeg. We have been identifying sites. Remember, a lot of this work is still conducted by the regions themselves, and so we have all partners on board there. I know that there are considerable efforts that are being made to link in with our Crown corporations to know if there are sites, as we have done before, that would be available to us as well for that for that purpose. It's necessary to have enough testing, but as you say, it's also necessary to have the capacity in the right place.
And Minister, while we have you here today, what can you tell us about the restructuring of senior directors and health regions and AFM and cancer care and whatnot? How many directors are losing their positions?
Oh, I think you're referring to our SDO realignment, right? Okay, so I don't have those numbers in front of me. Our government has said that we value an improved healthcare system that is more efficient, more aligned, more coordinated. A lot of this we've called our transformation of the healthcare system. In that work, there are some redundant positions within our operations. Work has been done to identify where those areas are, back office areas, payroll, human resource, accounts receivable, and work is being done to provide notices to consolidate some of those positions. But remember, then many of those same people who might see one position eliminated will be available and eligible to apply into the new roles.
And those meetings took place today, and people were told that, they were also told that they can then, if they didn't get a job in the first round, they could maybe apply in the second, but there will be a net reduction. So do you have are we talking about dozens, hundreds? How many at the end of the game or days, I apologize for that flub, end of the day, it's not a game, how many fewer positions will there be in the healthcare system?
There will be some for sure. This is intended to get, like I said, more coordination and better results. There will be some positions that are shed as a result of this. But like I said, the emphasis, of course, today is on communicating clearly to groups that there will be new positions created that they're eligible for.
And the last question about this, and when we're talking about these are senior higher up positions. These aren't frontline workers at all.
That's right. And that's what we've always said, that our emphasis as a government is making sure that we are trying to create the focus on frontline healthcare. For years, we felt that our healthcare system, and certainly the analysis that we've done since election, has shown us that the healthcare system was top-heavy. We're needing to push those resources now more than ever to the front line. And this is an issue of finding the synergies and the efficiencies that are there staring us in the face and making sure that we're taking those up. The aim, of course, is to deliver the best health care possible to Manitobans.
Mr. Friesen, at the screening sites, sorry, just getting back to the COVID-19 screening sites, data entry, inputting the names and the addresses is done mostly by hand, and it's really quite time consuming. What work is being done to speed up the system so that when a health number is entered, all the contact information comes up as well? Do you know anything about streamlining that system?
Yeah, thanks for the question. That's all part of this this overview that we will conduct. Everything from workflow, what are we doing, workflow, like what are we doing analog that could be done digitally? Are there digital solutions to support the work? Where do we have workforce? Do we have the right complement of people on these sites? Where do we find that we need to flex up capacity? What is our surge capacity? In other words, if we need to add more, how quickly and efficiently can we do that? So this is really a stem to stern analysis that we are driving on an expedited basis, because now is the time to do it. I just had a federal, provincial, territorial call with all my counterparts in jurisdictions last night, and it would seem that the attention that Manitoba is placing on this priority area is shared in other jurisdictions as well.
And back to John Pritchard, forgive me to jump around here. Have you figured out if that first case was the index case?
We haven't confirmed that as of yet. So the first case definitely, is the index as of right now. But we are there is some testing that's pending that may provide even more information to us.
And on the testing that we asked about, is there a service available for people who don't have a car and can't access a testing site?
Yeah, it's a good question, and we're trying to get the ability to have more remote or testing being done. You've seen some examples of that already in some of the communal living situations where there's outreach. Within the city, it's probably, we do have similar outreach for people who are living in, say, shelters and things of that nature.
And just speaking of people in shelters, on October 1st, the suspension of evictions for residential tenants is being lifted. And if there are a number of people who are become homeless or have to couch surf or have to share space or go to a shelter, are there public health implications or concerns about that potentiality that people might be out of a home October 1st?
Well, I mean, homelessness, all these things are a public health concern at any time, not only during a pandemic. Certainly, it adds concern to to vulnerability to the pandemic. So it is an issue. Like we said, there's much more to health than just this virus, and housing is certainly one of those things.
I would just add this, that I believe there will be an update provided soon. I know that Minister Stephenson and Families is working hard on the issue of extending provisions that are currently in place for things like the shelters in Winnipeg. So I believe there'll be an update on that work soon. I know they're hard at work.
So there'll be more shelters for more people, anticipating that there will be more people homeless after
Like
October 1st?
I said, we've made some very significant provisions to those who deliver services in Winnipeg, and I believe there's considerable work to be able to extend that, but that, I believe that update will be coming from the minister quite soon.
Is there a way, or rather, are certain tests prioritized over others? And this is just anecdotal, but I've spoken to a few people who've been tested recently, and they were asked whether they work in the education system. Is that just a standard question, or is that helping their test be prioritized at all?
Right. Yeah. So there's two things that go on. So one is there's certain occupations that we try to get as much information on the requisition as possible, because when that requisition is reported back to public health, that's all we see is that as a result that information until we start contacting that person. And priority, there's not a bunch of it for frontline healthcare workers. There is some prioritization to that, but for the most part, it's more about trying to collect as much information as we can.
Are you aware of any additional letters going out to John Pritchard parents about any additional exposures beyond what you talked about just now?
Additional exposures? I'm not aware of additional exposures with that, yeah.
Dr. Roussin, how was the target of 3,000 daily tests reached? Was that based on anticipated need, or was it a costing, was it a balance between anticipated need and costing, or how did that number come to be?
Yeah, and you know what, there isn't an exact science for that. At the beginning of this, we started calculating on, what we would normally see in respiratory virus season, looking at things like the R0 of this virus. At that point, it's more expert opinion, but we felt if we were testing 1% per week, then that would probably give us there. And so that's where the 2,500, 2,000, 3,000 case tests came from. But we may find that given any given respiratory virus season, we might need more.
Right. So was the school year ever considered? Because with 220,000 students, 20-odd thousand teachers and staff, we're looking at like 100 days of testing exclusively, right?
Well, we were, it was certainly considered because our calculation basis was on a typical, or what we would see in a respiratory virus season. So we were considering testing for flu, for RSV, as well as having kids back in school. So it's not exact. It will depend on what the underlying respiratory virus season is, because like we say, we're going to see a lot of symptomatic people if this season is like any other season, and the only way to differentiate those other viruses from COVID right now is with a test.
In Australia, they had almost, because of distancing, they kind of didn't have a flu season.
Correct. When we see many of the southern hemisphere flu seasons were record lows. And a lot of that is because influenza is spread much the same way as COVID-19, and all the precautionary fundamentals that we have in place now, we expect to protect against the flu as well. I don't know what their flu vaccine uptake was, which could be another contributor, and we're certainly looking to have a much more vaccine uptake this year as well.
And now that Prairie Mountain is going back to yellow, and Brandon's down to 22 active cases, can you tell us more about the clusters or the communal living situations in that region that you maybe didn't want to talk about before for fear of stigmatization, but now that risk is kind of gone? So,
well, no, there's not a whole bunch. We do know that it started with a cluster that was related both in time and place and geography. We knew that they had many of them had a common workplace, and that workplace there now was up at 86 total cases, now down to 4 active cases. And then what we found was that then we noticed many more clusters developing that were probably connected to the original one. We couldn't really connect it, and then we saw that a lot of the spread we were putting through were many gatherings, large gatherings. That's why we targeted that restricted status to the gathering size.
And there's still been no evidence of spread within that workplace, correct?
That's right. Yes, we never received evidence of interfacility spread.
And what about, can we talk about spit tests for a second? Dynacare says it's developed a technique for spit tests that would be 98.4% as accurate as the nasal swab. Is that something that the province is looking at? We've got dealings with Dynacare already. Is this something that you're investigating?
Well, just any promising new modality of testing we look at for sure. So right now, the evidence that we see is that the sensitivity of that test is not that great as of yet. We know it does change over time and things emerge. So we may be looking at something that does provide that sensitivity. The other issue is right now that method of running that test isn't conducive right now to high volume testing either. And again, that can change as well. But so yeah, absolutely, we're looking at that, and that would be a huge benefit to us if we had a sensitive test that we were able to run high volumes on.
Following on that, do you know what the false negative rate is for the nasal swab?
So I mean, that's really the sensitivity, right?
Yeah.
So the sensitivity measures, how many, the likelihood of a false negative test. So I don't know the specific number. From what I hear from the lab experts is that a negative test in a symptomatic individual is quite high. Like probably in that 90s. But I don't have an exact number for you.
So, sorry, just to clarify, a negative test in a symptomatic individual.
That's right. Has high sensitivity, which means it's very unlikely to be a false negative.
Gotcha.
So a negative test, like we always say, a negative test in a asymptomatic person does not have that what we call negative predictive value. The value of that test is not great.
Thank you, Doctor. We're going to go to the telephone now. First up from CJOB, Clay.
Yeah, good afternoon, gentlemen, and it's for either Dr. Roussin or Mr. Friesen. You both have talked about the upcoming flu season and the importance of getting a flu shot. I was out just the other day doing person on the street interviews. Did a lot of them. There's a lot of people who are saying, for sure this year I'm going to get a flu shot. But there were still others who were adamant and said, I've never had a flu shot. I don't intend to get a flu shot. Nothing would make me get a flu shot, pandemic or no pandemic. Do you have a message for those people who, for whatever reason, are just dead set against getting a flu shot?
Well, my message would be get a flu shot. But to that question, Clay, I would say that system leaders have really clearly said that we believe that there will be a higher uptake this year simply because of their sensitivity to these issues. And so in order to plan effectively, we are ordering more than 20% additional vaccine for influenza for this year's season. And in addition to that, on the basis of advice by experts, we are also increasing what's called that high-dose flu vaccine. We became the first province in Canada that was giving those to all residents in personal care homes. But in this year's campaign, you're going to see a very significant expansion of that as well. So I'll allow Dr. Roussin to answer anything else he'd like to on that question.
Mm-hmm. Yeah, and I think that a lot of this is risk perception. That when there's a common something that people are used to. We don't. We usually under-perceive the risk, and we know influenza kills thousands of Canadians every single year, and yet, only about a quarter of Manitobans up to now avail themselves of a highly effective preventative measure such as the vaccine. So certainly recommend everyone who's eligible to receive that vaccine. And just like the fundamentals that we talk about, washing your hands, physical distancing, wearing a mask, this doesn't only protect you, but it protects the people around you, the people you care about, and so it's just one more way of Manitobans doing their part.
There was a sign outside a Shoppers Drug Mart just down the road, outside the door, saying flu shots coming soon. Any idea when they'll be available at pharmacies and doctors' offices?
Yeah, very soon. As a matter of fact, just today I was receiving updates on our preparations for our flu campaign our influenza campaign this year. I can tell you that we have already received in Manitoba 78,000 doses. We are expecting full shipment of orders in the next few weeks. We have a vaccine coming from 3 different suppliers here in Manitoba, and then that will of course be distributed first through public health and then through doctors' offices and pharmacist offices. And so we will expect probably within a week or so that those first doses will be administered.
From the Winnipeg Sun, Scott.
Good afternoon to you both. I suppose, first question for Dr. Roussin. And this, I've asked this many times, but okay, so we're at 209 active cases in Winnipeg. We've obvious evidence that mask mandatory usage and gathering size restrictions works in Prairie Mountain. At what point will you look at doing the same thing in Winnipeg? Obviously, there's not as many outbreaks or whatever, but just to get that number down, obviously it works to do that, even if for a short time, 3 weeks, whatever. When is Winnipeg going to get a mandatory mask mandate?
Yeah, and so like we've said, there's a number of indicators that we look at. Remember when we went into Orange and Prairie Mountain Health, they had 240 active cases with a much smaller population. So if we look at the rate at when we went into Orange there, it's much greater than what we're seeing in Winnipeg at this time. We knew in Prairie Mountain Health we had very targeted epidemiology that showed us where the transmission is taking place. And so we were able to target a very specific area without imposing widespread restrictions. In Winnipeg, we're not seeing the rate that we saw in Prairie Mountain Health. We don't have as clear as in Prairie Mountain Health as what's driving the cases. We see some community-based transmission. Much of it is just close personal contacts. So again, it's many indicators. We keep following it, certainly the trend right now in Winnipeg is not what we're looking for. We're seeing increasing cases over time right now in Winnipeg, and if we see that trend persist, then we may need to look at ways to limit that spread.
Okay, thanks. And is it possible, for my follow-up, is it possible that the province restricts testing again as demand increases this fall?
Well, we need to have a testing strategy that gives us our best shot at reducing spread of the virus. So if we had a respiratory virus season where many people were symptomatic and were straining the test capacity, then certainly we would want to limit the amount of asymptomatic testing that's being done at that time. So we're always going to be focused on the highest risk individuals to ensure we can meet that demand.
From CTV, John.
Hello, Dr. Roussin. I just have a question in regards to the testing and with people experiencing very long waits and some being turned away. Do you have any concern that some of those individuals will decide not to bother with the tests at all and, may not get tested at all?
Yeah, and so I mean, we've been saying here our testing capacity is really important to us, and that capacity has many aspects to it, and so we're looking into every aspect of it. So we definitely don't want to be in a position where we're turning people away. We want to encourage people to be testing. So we are going to be trying to improve that, and in short order. The message out there is that symptomatic people should not be going to work or school or out and about. So whether you're able to get a test or not, we don't want symptomatic people going out in public. They should be isolating. Ideally, we can test them because then we can do a contact investigation. But with or without the test, and again, it's going to be a challenge this flu season, is we can't have symptomatic people going out and about with or without a test.
Thank you. Can you also give us a little bit more of a sense for where the different infections are coming from in the Winnipeg health region? Have you found that recently that there's a lot that are being acquired through travel? Is the majority through community spread? Can you give us a bit of a sense as to how people tend to be acquiring the virus?
Yeah, so travel has dramatically decreased the number of cases that we relate to travel. Our 7-day rate related to travel is still at 2 cases in the whole province in the last 7 days are related to travel. The vast majority relate to known contacts of cases, where about that 20% is that community spread.
From City TV, Mike.
Yeah, good afternoon, Minister and Dr. Roussin. My question is, in the winter on those minus 40 days, say I'm someone who doesn't have friends or family in the city and I get tested positive for COVID-19, and I'm trying to self-isolate, but I don't have access to get someone to get my groceries, I don't have access to have someone run errands. Is there anything the province is doing that can assist these people aside from them just hopefully living off of things like skip the dishes or something like that? Is there any maybe assistance coming in the winter?
Well, there's been a broad array of forms of assistance that have been emanating from this government for people, but this, the scenario you describe is one that could be there, where people are without a real significant network, and they're having to find themselves at home and to self-isolate. So, I think it has to be a comprehensive response. We know that people are demonstrating a lot of resourcefulness. We know that communities are coming together. People are making new friendships to assist them. We know that grocery stores and pharmacists worked overtime to create the conditions where people who were not symptomatic but exposed to the virus, maybe because of immune systems or their age, could come in and receive services. So I guess we'll have to continue to dig deep as a province, all of us together, as Dr. Roussin would say, to be able to help each other, friends and neighbors, to make sure that people are not falling through the cracks.
Right, and my follow-up question, thank you for that, is we've had some parents say that their kids are saying on bus rides to school, I know it's still early in the school season, that cohorts are kind of mixing and intermingling on bus rides. I know that this might be a difficult question to answer, but is there anything that we can do on buses or teach these students to do on buses to kind of make themselves a little safer if there is intermingling going on, to just kind of try and stop a spread between cohorts?
Yeah, I think this is a challenge with our with the children, adhering to a lot of the policies. Certainly, our framework, our back to school the framework, would limit the mixing between cohorts. So on buses, we know masks are required. Family members, those from the same household, can sit in the same seat. And then those who are involved in the same cohort would be able to sit in the same seat. Other than that, there should be a separation of those cohorts. Obviously, there are challenges that we know, and we always say that we're not going to reduce risk anywhere in our society to zero, but we do have things in place to try to limit that risk.
From the Brandon Sun, Emily.
Thank you. My question is for Dr. Roussin. Honestly, my original questions were going to be about Code Orange, but you've answered some of them right at the beginning. I'm just wondering, what were the specific indicators according to the Restart Manitoba Pandemic Response System that resulted in Prairie Mountain Health being taken down to yellow from orange?
Yeah. So there's a number, like we always say, there's a number of indicators we look at. And so we could look at the total cases. We could see that dramatic decline over those that time frame. We saw the percent positivity rate dramatically declining over that time as well. And we just saw, with it, we were certainly looking at that, the workplace within the Brandon area that had a decline as well. So there's a number of indicators that we saw, and overall, it just showed us that the transmission, the rate of transmission of the virus had been declining and staying stable for a number of time, and we're almost now into the second incubation period since we put the restrictions in place. So we felt it was an appropriate time to demonstrate, really demonstrate that how that pandemic response system is set to work. We saw trending epidemiology that made us concerned. We implemented targeted restrictions, and we followed those numbers closely. And as soon as those numbers are favorable, we then lift those restrictions.
Okay, and my follow-up is, when will we know if any of the level red situations at a number of care homes in Brandon, do we have any indicator of when their status may be changed?
Yeah, so I don't have a specific date on any of them. What we typically will do is 2 incubation periods, so 28 days after the last case in the facility, then we'll usually lift our outbreak protocol. So it's the same thing with influenza. We do that, although influenza's incubation period is not 14 days. But we will we'll usually do the 2 incubation periods and then lift the outbreak.
From CHVN, Taylor.
Hi, good afternoon. Now that we're seeing an increase in demand for testing, and we know that not everyone has their own vehicle, it's not advised to take public transportation. If you live far from a site, walking is not exactly ideal, especially in Manitoban winters. What is being done right now to increase accessibility to testing across Manitoba?
Mm-hmm. Yeah, I think it's a good question. We have those number of sites. We ramped up our testing capability. We saw in the summer where we had very decreased demand for testing, and then now we're back in the mode of ramping things up. So we'll certainly be ramping up our testing capabilities certainly at the sites. But part of that evaluation that we plan on doing is going to look at every aspect of our testing capabilities, and so I think it's a good thing to think about is the outreach to those who may not have access to sites, even when our access is up and running at a full capability.
And Dr. Roussin, you talked a little bit about asking people not to stigmatize, but this can be done accidentally sometimes. And what are some of the things that you're hearing from people about examples of stigmatization, and how do we avoid that?
I think that when we're talking about in a school, and I think that's the latest example of it, where in schools, if you have an individual, whether that's a staff or student, and you hear that a case has been identified in that school, and then there's somebody who's away, there's a risk of identifying that person. And remember, that person acquired it somewhere unbeknownst to them. And so we can't, call them out. We can't treat them negatively. We can't try to identify who it is if there's a number of people away. Because what we do know is that the next time someone has some symptoms, they're going to think twice about getting tested because they don't want that attention drawn to them. So you know that as we treat people with this well, then we know that it's not going to deter people from getting tested. So those are the type. I don't really have specific examples of stigmatization, but those are the concerns that we see, and we see this with many conditions, not only a pandemic.
Thank you, Doctor. Time for a couple more questions from the floor.
Dr. Roussin, Emily reminded me, could you give us an update on the number of active cases in all the health care, personal care home facilities right now?
Right, yeah, so I'll say for the sake of time here is that there's only one that has a change to it, and that is Bethesda Place, where there is a 14th confirmed case. And so that is now, and that was a staff member. So now there are 8 staff and 6 residents total involved in that.
You announced that yesterday though, right, or no?
That was to 13.
Oh, the 13th, forgive me, thank you. And as this happens, a lot of people watch these things and they follow everybody here. A number of people have asked me to ask you if you're aware of a St. Vital Mall public exposure.
I haven't had that brought to my attention yet. No.
Speaking of malls, we're a little ahead of the Christmas shopping season, but many Manitobans work in retail. Thousands of Manitobans crowd into the malls pre-Christmas time to go shopping. Is the government contemplating any measures, any limits on crowd capacity in malls, or any special measures beyond what's in place now under the yellow warning system?
Right, so I mean, we do have those options in place, and it's not going to be based necessarily on the seasons. Be based on the epidemiology that we see at the time. So we do have measures in right now that physical distancing is required, and so we need to change the way we do things. So the malls this year are going to look much different than they did last year, and so we're going to need that physical distancing. Hand washing. No one's going to be in there who's ill, and come that time, if there's a number of people shopping and you're distancing, we're going to see a lot more people wearing masks as well.
So, I mean, it's hard to maintain social distancing in the hallways of a mall, for example. I mean, stores can do things, but then you've got the mall itself, got entrances and exits, and I know there are times where you've limited the entrances and exits, but this would be a time of year when people pack into malls.
Yeah, well, the operators are required to abide by the public health orders, and so we can't have packing in of people in those malls. So they'll have to maintain distance. They'll have to have procedures in place to maintain that.
And Mr. Friesen, would there be more enforcement, given that that's where more people are going to be?
Well, I mean, enforcement is always part of this calculus. I always say, and we continue to state that the emphasis has to be placed on education. I would say, though, to your question that there's been enormous response by retailers and the business community to keep their staff and their customers safe. That will undoubtedly continue, but also part of our pandemic response system has been a very, very effective and detailed canvassing of retailers and effective communication with them. So we know that as we continue to stay in contact with these groups and hear what they're hearing, that plans will be made to continue to keep their customers and their clients safe.
Because we've all seen, or heard anecdotally about stories about customers who won't stay distant. And it's a minority, but when you're talking about thousands of people, it's still a significant number.
Yeah, and none of it is easy. The vast majority of Manitobans get this. There are some people who, people are under a lot of pressure, and I'm not making excuses for people, but we hear anecdotally of people who lash out at someone in a retail environment or in a business setting, and it's never good. And it certainly is troubling for those who are trying to run a business, who are just trying to do the right thing. So I would say, enforcement has always been part of the government's overall response to this. But at the end of the day, for every time we have an enforcement, we better be giving a message clearly and coherently a couple of hundred times, because I think that given the right information, the majority of Manitobans really want to do the right thing.
Awesome.
Minister Friesen, this week you gave us a glimpse of what the visitation shelters will look like for personal care homes. And, you know, people responded well to that, but there are some people saying 90 shelters for $17.9 million, that's $200,000 almost each. Can you just give us a better idea of, you know, what that cost is? Like $200,000 for a 40-foot shipping container? Like, why so much?
It is a lot of money. We're not discounting that. I think this government has been very clear that we take the issue of spending taxpayer dollars very seriously. It's why we undertook a competitive process to get to this point to award the contract. But I would want Manitobans to keep in mind as well that this isn't just for the procurement and then the reconstruction of those shelters. This amount per unit also then attends to the conveyance of the shelter installation on site. It has to do as well with other factors that have been taken into consideration. And of course, we're asking this to be done under incredible time constraints, and that has to be factored into the contest. I know that Manitobans who are expressing this, they mean well, and they want taxpayer dollars to be well spent. We would say to them, when we consider the 7,000 deaths in long-term care facilities in Quebec and Ontario that took place, it was a national tragedy. We believe that this is the right investment we are making to ensure that we don't have to close the doors to long-term care facilities and to shutter in the residents and to keep the families out.
Thanks, everyone.
Thanks, everyone.